The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. I hope everybody's having a great start to their week on this rainy Monday here in Michigan. Um, Thank you, everyone, for joining us today. We know how busy everybody is during this time, especially. Today, we wanted to say thank you to Leading Age for being part of our Safe and Calm webinar series. Today's presenter, Linda Couch, is the Vice President of Housing Policy. Linda has more than 23 years of experience in federal affordable housing policy, 8 of those years with Leading Age and 17 years with at the National Low Income Housing Coalition. Along with many years of experience, Linda has also testified before House and Senate authorizing and appropriations committees. We greatly appreciate Linda taking time to share her expertise with us today. As you can see, under the handouts tab, I have included the handouts for today, so you should be able to go ahead and download those right now. With the same as these webinar series has gone before, if you do have any questions, feel free to put them in the questions chat, and we will go ahead and go over those questions after the presentation has concluded. So I think that takes care of everything that I need to talk about, so I will now turn it over to Linda. Thank you.
Great, thank you, Blake. I'm happy to be here. Thanks everyone for taking the time to get on today's webinar. And we were hoping to use our time together this afternoon to go over some key developments, issues, happenings, both at HUD and at Congress related to affordable senior housing and COVID-19. And I'm going to jump right in here and make sure you all are aware of Leading Age's affordable housing and coronavirus website. We have websites for different provider types, including one for our affordable housing members. There are different sections on this website, insights from Leading Age staff, from Congress, tools and resources. And we hope you find this website useful. We keep it updated. I'm sure there's at least a couple or a few new things on this page every day, but it's a great place to check for all the latest news. And the link to that page is at the bottom of this particular slide. Jumping in, one of our goalposts for what we know HUD is and isn't up to regarding affordable housing and COVID-19 is the periodic release of HUD's frequently asked questions from the Office of Multifamily Housing. The Office of Multifamily Housing, I think, has issued 3 or 4 iterations of their FAQ. The latest one was a few weeks ago now on May 1st. We know that they are working on another, the next iteration, and we talk with HUD staff fairly frequently about what's in the FAQ, what we think should be in the FAQ, questions we have that we hope make it into the next FAQ. I did want to highlight a couple of things from this May 1st FAQ, and there's a link to it here on the slide, but then on our website you can find detailed information about what was in this latest May 1st FAQ. In an article we've posted, but we just want to let you know a couple of things in here from the May 1st frequently asked questions from multifamily. One is that HUD lists out a pretty extensive resources summary for food insecure residents, and we found that interesting. So links to elder care locators sources for food pantries, meals programs, those sorts of resources. It's the same FAQ where HUD says clearly that use of project funds for meals is not an eligible use of project funds. And they go on to talk about these other food and meal resources. We remain disappointed in that decision, and hopefully that will change. But for now, HUD has said clearly in this FAQ version that project funds cannot be used to provide meals for residents during the COVID period. Another issue that HUD touches on again in this May 1st version of the FAQ is around move-ins and move-outs. And Leading Age has all along urged HUD to expand its vacancy claims process to help owners stay solvent, even as they pause move-ins to accommodate the concerns of new and existing residents. And I would say in general, HUD has been accommodating in move-in and move-out issues in a lot of respects and taken on issues on a case-by-case basis. But they have held so far, and we hope this changes soon, in saying no to extending subsidy payments beyond a 14-day the 14-day deadline after a sole resident of a unit passes away. So we're hoping to see some more give. We are aware of a couple of HUD regions that have taken those cases on for Leading Age members on a case-by-case basis, but we would like to see something in a subsequent FAQ that gives owners a little more clarity about vacancy issues regarding the 14-day deadline. Moving on, beyond the FAQ, HUD has also issued a brochure called Addressing Tenant Concerns During the COVID-19 National Emergency, and there's a direct link to that brochure on this slide through our website and also through HUD's site. You can also access this tenant brochure in several different languages, which is great to see that HUD's posted those now. The brochure is basically an effort to educate tenants about the 120-day eviction for non-payment of rent moratorium that was established by the March 27th CARES Act, one of the earlier COVID relief packages. And throughout this tenant brochure, HUD just tries to make clear that the eviction moratorium is for non-payment of rent. It is not for other issues. But you'll note in the FAQ that I just mentioned, HUD, and actually in a fair housing document that HUD issued in April, HUD does encourage owners to basically go easy on evictions during COVID when they're not related to non-payment of rent. But the brochure will hopefully help educate tenants about how it will be their responsibility to figure out how to come up with whatever rent payments are left behind if they decide not to pay, or they decide to, or they can't pay their full rent during this 120-day period. Another issue that we've been talking more and more about these last couple of weeks has been reopening, and I know this is an issue in Michigan, it's an issue in a lot of states, figuring out what Leading Age National is going to say about reopening. We have made a really clear decision that it's not in our bailiwick, to offer any advice about a particular community or locality, but we are eager and happy to pass on resources from the White House, from CDC, and from HUD around considerations that the White House, CDC, and HUD have said that affordable housing providers are going to want to consider as they think about reopening. And here I have links to two articles on our website about these considerations and about resources that HUD and the White House have shared. But I want to call out a couple of things in particular. One is around move-ins and move-outs. And that's obviously a big issue when it comes to thinking about reopening. Out of concern for residents and staff at senior housing properties, or even in response to state or local travel restrictions, many housing providers have chosen to temporarily suspend or freeze new admissions to the community. Of course, there are exceptions for some scenarios, but a lot of communities have decided to put those suspensions or freezing into place, while other providers have been, continuing their move-ins throughout the pandemic. In the May 1st FAQ, which I mentioned at the beginning from HUD, HUD continues to encourage owners to lease up units where safely possible. And so I think that, thinking about how your organization is managing move-ins and move-outs and the readiness of your community to change its policies, thinking about a reopening or repositioning is one of the big considerations housing organizations are going to have to really think through as they think about their next reality. Another bucket of consideration is around visitor restrictions. We know that limiting access to senior housing communities was one of the first and probably most important changes that housing providers put in place at the start of the pandemic. We know that affordable housing visitation policies are set at the property level by owners, and HUD for the, by and large defers to local and state requirements or to directives of health officials on what policies should comprise these visitor restrictions. But HUD has been really very clear from the beginning that any visitation policies, and this includes adjusting your visitation policies, have to keep in mind that you're open for essential access by essential services providers, and you have to be really mindful of fair housing and civil rights issues. And so when it comes to thinking about and considering reopening, what your visitor restrictions look like today and how they may or may not need to change, or what makes sense to change, is another big area of consideration. And then finally, your workforce. Throughout the height of this crisis, many providers have adjusted their staff and their service coordination workflows to off-site wherever possible. And this approach has limited exposure risk for staff and residents, and has been one of the more flexible arrangements of affordable housing providers. But thinking about how it is that you quote unquote reopen, and how you are able to manage a remote workforce, bringing more people in or taking more people off site is a big deal. Did make clear in its May 1st FAQ that multifamily housing providers won't incur penalties for curbing office hours as needed for safety reasons. And so this is another way that HUD again has put the provider in charge of assessing what works for your housing staff and your residents. We think it presents an opportunity for housing properties to innovate a way into whatever their new reality is. The links on your screen for this slide point to two articles which really go into HUD suggested worksheets that we think are really smart for you all to look at and work through. There are 4 particular worksheets around thinking about reopening, what it means for you all to be resilient agencies. The first is a tool for staff and management to really think about how you might restart or re-engage in your operations. So what lessons have you learned, identifying and applying those lessons. And it's a worksheet that is going to, it looks like it would really help your teams identify what worked well during the pandemic so far, and what you might want to carry forward to your next reality. The second is an ADA compliant pre-pandemic employee survey. So here, this is a way for you to think through in an ADA compliant way plans that you might need to have in place for employee absenteeism. So this might help employers identify non-medical reasons that an employee may miss work during a crisis. And then finally, two other worksheets, one on an individual continuity planning worksheet. Again, these are all from HUD recommended worksheets that this is basically a chart that will help staff identify job functions that can and should be continued and how they could or should be modified or prioritized in response to the crisis. This worksheet chart also prompts you all to consider dependencies for job functions. So which jobs and functions rely on other jobs and functions as you think through the functions that are going to be necessary moving forward. And finally, in this reopening kind of toolbox from HUD is a risk assessment table. And this is really a tool for assessing risks in your operations. So really pushing you to identify vulnerabilities or weaknesses by creating hazard ratings for various operations, which HUD thinks will help prioritize your work and help you plan for not only emergencies, but for recovery. So we wanted to share those with you. These are not things that Leading Age has come up with, but these are things that HUD and CDC have come up with. On our website, you'll also find a pretty short overview of the White House's plan for reopening America and what those three phases mean for affordable senior housing. There's nothing in there particular to affordable senior housing, except I think it's interesting to look at where the White House believes state and local governments have to be to even enter phase one, and then every time they move into the next phase, the different protocols and resources that need to be in place. We do, of course, have a list of outstanding issues for HUD. I would say in general, HUD has been really responsive to our asks. Very early on, we saw a lot of guidance come out very quickly. That slowed down a lot, but we have, we've seen a lot around suspension of income recertifications and interim recertifications, the allowance of wet signatures, suspension of inspections, suspension of MORs. We're a little worried about those, but right now they're, especially we know in places where there is stay-at-home orders, suspension of MORs. And I would say in general, HUD's been very responsive to our asks, but we do have a fairly long list of things that we're still asking HUD to do. And I put a couple of the big ones on here. I mentioned this 120-day eviction moratorium for non-payment of rent. We, like really all housing advocates, are really worried about the massive evictions cliff coming at the end of this 120-day period. That looks like it'll fall around June 24th or 25th. There's some disagreement in HUD about what the exact date is, but what if, and I don't know, particularly this is probably more not so much a senior housing issue, but for the seniors that does impact, it'll be a very big deal. How is it that a lot of people who have needed to take advantage of this evictions moratorium for non-payment of rent, how are they going to repay their rent arrears? And Leading Age is asking HUD for some basically financial incentives to enter into payment plans with residents. Right now, there's almost a financial disincentive to do so, which doesn't make a lot of sense to us. Another big issue is this 14-day move-out issue that I mentioned around the current 14-day deadline for vacating units. We really believe that owners need to be able to give families more time, and that it's necessary to extend the subsidy past this 14-day deadline. The third issue here is around use of funds. Right now, HUD-assisted housing providers can't use project funds for the benefit of residents, and they can't use residual receipts for the benefit of residents. And this includes for direct services and for meal supports for residents, even in emergency. So we are urging HUD to use the broad waiver authority that the CARES Act gave HUD to expand eligible uses of project funds to be for the benefit of the project and of the resident. And we're eager to see what HUD does with our recommendations there. And then just broadly, the FAQ that I keep referencing is really HUD's. That's what HUD Multifamily has given us. They have not issued notices or guidance or memos, and we think that owners, providers would be much better off, much more protected, that the language could be much more clear and explicit if HUD did move forward and issue real documents that had the weight of law, which the FAQ, as it now states on its cover since May 1st, does not. And so, you know, we would really like to see some clear guidance around how the economic impact payments of, you know, the $1,200 checks should not be counted as income for purposes of rent determination, how the $600 unemployment insurance extra payments won't be counted toward income. I mean, these are things that HUD says in its FAQ, but I do think that there's some nervousness in the affordable housing world about taking that FAQ and it having the force of law the next time you all have an MOR or that kind of inspection. Kind of really switching gears, we wanted to share with you some links to the recordings of a cleaning and disinfecting HUD Multifamily did at the beginning of the month. They did a webinar on cleaning and disinfecting for multifamily and one for public housing, and you can link to those here in both Spanish and in English. The webinar, and I'm going to tell you, if you haven't listened to it, you'd be much better off listening to it now because the audio quality was pretty poor. So you'd be better off listening to it now. But I would say in general, the webinar really emphasized two ways to continue being the safest communities that you can be, and those two ways were through distancing and disinfecting. And on distancing, the webinar talked about keeping your common areas closed as much as possible, keeping building access restricted to essential services, and utilizing face coverings or masks. And then on disinfecting, of course, the webinar talked a lot about cleaning and how to remove germs effectively, but also disinfecting or killing germs, especially in frequently touched surfaces like doorknobs and light switches, and doing those things often. Anyway, I highly recommend if you haven't watched or listened to the webinar, you do so. I thought it was very well done. We also wanted to let you know that we've been doing a fair amount of advocacy related to affordable housing and the SBA's PPP program, the Paycheck Protection Program, which is one of the first COVID relief programs out of the gate by Congress, has had its share of snags in general, and a couple of those have related. Well, there's one big one that relates to affordable housing, and that we know we have a lot of affordable housing members at leading age who have gotten approved for and received PPP loans. But we are also aware of really too many members, nonprofit affordable housing providers, who have been told by their local SBA office that they are ineligible to apply to receive the funds because they are nonprofit affordable housing providers. And we believe that the SBA laws are pretty clear, are very clear, that for-profit affordable housing, real estate developers are not eligible for this kind of category of SBA loans, but there's nowhere in the PPP authorizing statute or implementing guidelines that say anything about nonprofits not being eligible. And so this is just the header on the slide of a letter that Leading Age has sent to the SBA seeking some clarity on that. And so that's something that we're really focused on, that we're constantly following up with the SBA on and working with Congress on too to get some clarity on that. As far as the PPP loans, I will say that HUD has basically said they are going to do whatever they can to not be an obstacle to HUD-assisted housing organizations participating in the PPP process. And we know that right now HUD is working on figuring out how a PPP loan, if the SBA could make clear that nonprofit organizations were eligible for these, how the loan is compatible with a multifamily or other type of HUD loan. We think that HUD's reasoning and outlook on this looks really favorable for affordable housing providers, but we're just waiting to see that formally written down. We also expect HUD to issue guidance soon on what the PPP funds can be used for and how they're really supposed to work in concert with a HUD operating subsidy. Switching over to a few things in Congress, I've mentioned the CARES Act a couple of times. This is the first largest COVID relief packages that got signed into law on March 27th. This is the bill that included the 120-day eviction moratorium. It also included funds for the Section 8 project-based rental assistance program, for the Section 202 program, including $10 million for service coordinators, and funds for CDBG, homeless assistance, public housing, etc. As far as the multifamily dollars, the project-based rental assistance and the Section 202 money, HUD is getting that money out the door in two ways. One is that they are using some of the PBRA and 202 money to get owners those CARES Act dollars who where they see decreases in tenant incomes based on tenant income recertifications. And so, we think that's fine, great, definitely a way to help fill the gap left by decreasing tenant incomes. But the other thing that HUD has to do with these monies is try to figure out how to get those dollars to owners just to pay their COVID-related expenses, which have really nothing to do with their loss of tenant income because of COVID. And so HUD is figuring those two things out, and while they're also figuring out how to get these the $10 million out the door for service coordinators, and those dollars will be, we expect, exclusively to help support existing service coordinators, the cost of their programming, bonus pays, replacement staff, those kind of issues. The CARES Act included no funding for USDA rural housing service, and so while there was about $12 billion in there to help stand up HUD's programs and provide rental assistance through HUD's programs and help support COVID costs and decrease tenant incomes, we're really surprised, shocked to see no dollars in there for the rural housing service or to help housing credit communities and their residents. That CARES Act is, as I said before, that was the bill that included those economic impact payments from the IRS, and the $600 in emergency unemployment insurance. So that was a big deal, and we are still working through how affordable housing communities and their residents are benefiting from the CARES Act. On Friday, you all saw that probably in the paper that the House Speaker Nancy Pelosi had introduced the next big COVID relief package, the HEROES Act, and that passed the House late Friday night. We were happy to see that that bill includes $750 million for project-based rental assistance and $500 million for housing for the elderly. We have been lobbying very hard for a $1.2 billion package of relief for HUD-assisted seniors across the 202 and PBRA portfolios. We've been told clearly by staff that we're the only group who's actually been asking for PBRA relief, and certainly for Section 202 relief. And we were thrilled to see that a key ask of ours included in the $500 million in the bill's resources for the Section 202 Housing for the Elderly program is our ask for $300 million for service coordinators. A little bit of that money, around $30 million, is for existing service coordinators, again, to help respond to COVID costs, but the vast majority of that is for new service coordinators in communities that do not currently have them. What was in this HEROES Act on Friday is most but not all of a package of $1.2 billion that Leading Age is asking for affordable senior housing. And a bill that would accomplish that was introduced as a standalone bill on Friday by California Congresswoman Katie Porter and California Congresswoman Maxine Waters, who's also the chair of the House Financial Services Committee. And so this bill, HR 6873, is Leading Age's package for affordable senior housing. And these are, of this $1.2 billion, there are resources in there for COVID response, covering expenses, vacancy claims, et cetera, for both PBRA and the Section 202 programs. There's also this same $300 million for service coordinators, $50 million for internet, for the installation of wireless internet in both community spaces and individual units, as well as the service fees associated with them. And then $7 million for a one-year extension of HUD's I Wish demonstration. And I know Michigan has several of the I Wish sites, several of HUD's 40 I Wish demonstration sites. We're just going to keep asking for that extension any place we can as COVID issues take over all the conversation. We have to keep reminding Congress that sunset of the I Wish demonstration that's coming up on September 30th needs to be extended, and we're hopeful that we can get that passed. The HEROES Act on Friday and the introduction of Leading Age's bill in the House, we know that the Senate introduction is coming soon. In the next couple of days. These are really the first volleys, and it'll be a few weeks before Congress figures out what it wants to do really on the next package. There's a lot of hesitancy on the Senate side, but also I think a fair amount of acknowledgement that more needs to be done to help people get through the pandemic. So we hope that you can reach out to your congressional offices in support of housing relief. There's this link takes you to our grassroots take action page, and really any calls or emails people can get into the House or Senate would be really helpful. You'll see an alert from us on Wednesday this week, really calling out specifically to get co-sponsors on these House and Senate bills. And with that, I'll say that, Leading Age is here for you all. There's my email address and my housing teammate, Juliana Bilowich. Juliana and I are always happy to answer your questions, take your calls. respond to your emails, etc. And with that, Blake, I'll see if people have questions.
All right, thank you very much for that, Linda. Let me go ahead and open up the questions section really quick. I am not seeing any questions that came through. So I will wait a second just in case anybody is typing one. But while we're doing that, I would just like to say thank you again to Linda for being a presenter with us today. I think we had 20 to 30 people, I would say, is our max that we had today. So, and again, we know that how busy everything is. So thank you to anyone who took the time out of their schedules to join us today on the webinar. We appreciate everything that you guys do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. We do have another Safe and Calm webinar coming up tomorrow as well at 2 p.m. So feel free to join in on that. And we also have a Housing Matters program scheduled coming up from Leading Age Michigan on the May 28th. So feel free to register for that. I am not seeing any other questions, so I think that will conclude our webinar for today. Again, thank you very much, Linda, and everyone have a great day.